Hello and welcome. Today we are going to be talking about modafinil. Modafinil is also known by the brand name Provigil and its longer complex chemical name, which I shall not pronounce. It was discovered originally by French scientists in the 1970s on accident while they were trying to create an analgesic drug. They did more research into modafinil and the compound was isolated and discovered to be a wake promoting drug.
So for the pharmacokinetics of modafinil, its administration route is mostly oral administration because that is where it's most effective because it is not water soluble. So the other normal routes of administration for some other drugs wouldn't be as effective with this drug, as well as it is absorbed mainly in the small intestine, and food can disrupt its absorption, but it shouldn't affect the overall absorption of the drug, even if it slows it down slightly. The peak plasma concentration is around 2 to 4 hours and has a half-life of 12 to 15 hours. This can be the draw of modafinil, but the slow effect and long-lasting aspect make it stand out from other wakefulness stimulants in drugs. Modafinil is also metabolized 80% by the liver through the enzyme of CYP3A4.
Modafinil affects behavior by increasing wakefulness, alertness, and cognition. Modafinil is often prescribed to treat conditions like narcolepsy, sleep wake disorder, and obstructive sleep apnea. It can enhance mood slightly, but does not produce a euphoric effect. Modafinil is also sometimes referred to as a smart drug because studies show that on top of the increased alertness, there are improvements in working memory and improvements on cognitive tests. These improvements were especially notable for those who were sleep deprived.
So, for the mechanisms of action for modafinil, modafinil actually blocks the reuptake of dopamine. It does this by acting as a dopamine transporter antagonist. This increases extracellular dopamine, exciting the dopaminergic system. Modafinil acts the same on the norepinephrine transporters, acting as antagonists to block the reuptake of norepinephrine. This excess norepinephrine creates increased alertness, arousal, and attention. With both increased dopamine and increased norepinephrine, this means that both the reward and anti-reward systems are activated. This is likely why there is not a euphoric effect produced, since typically the excess dopamine creates that euphoric effect. With the excess norepinephrine essentially pumps the brakes on that anti-reward system, so both systems are activated to increase alertness without affecting the mood as much.
Modafinil also has some secondary mechanisms of action that are likely due to the downstream effect of this increased dopamine and norepinephrine. These are an increase in extracellular serotonin, an increase in extracellular glutamate, and a decrease in GABA. All of these continue to increase the excitation of neural pathways and also alertness in the brain.
For the tolerance and withdrawal symptoms of modafinil, any tolerance to modafinil is pharmacokinetic and would be due to the downregulation of dopamine and norepinephrine receptors. Withdrawal symptoms from modafinil are not talked about as much as other drugs, but from what has been reported, modafinil seems to have a much milder withdrawal compared to other stimulants. But if you do experience withdrawal symptoms, they probably include things like fatigue, trouble concentrating, and or low energy.
Modafinil is a Schedule IV drug, meaning there is a recognized abuse potential. Modafinil acts on the dopamine reward system, which positively reinforces use and increases incentive salience. However, modafinil also acts on the anti reward system, since it increases norepinephrine. Typically, with drugs, the reward system creates a positive reinforcement during drug use, and then after the drug effect wears off, the anti reward system is responsible for the negative reinforcement of withdrawal symptoms. It adds negative symptoms that you wish to take away by doing the drug. But with modafinil, both of these systems are active at the same time, so the anti reward system is putting the brakes on the reward system in real time. Modafinil also has a longer absorption time compared to most stimulants, taking 2 to 4 hours to reach peak concentration and peak effects. This slower onset can also reduce the addictiveness of the drug.
Thank you to everyone for listening and coming to me in Anna's TED Talk. Bye!